All right. Well, hello, everybody. Thanks for coming tonight. I know it's a beautiful evening outside, and talking about chicken diseases doesn't seem like as much fun as being outside on a beautiful Alaskan summer evening. Can you hold off a second? I got to turn off a. My wife's cooking dinner and the oven's beeping at her. Anyway, I want to introduce Dr. Teresa Beck. She's a veterinarian here in Palmer, Alaska. This is just my opinion, but I think she's one of the few vets in the valley that treats chickens. Okay, thank you for joining us tonight. Also is Dr. Jason Dahl. Are you in Pennsylvania or Massachusetts?
Pennsylvania. I was in Massachusetts, but now I'm in Pennsylvania.
And now, a lot of Alaskans would question why we would get someone from the East Coast to come talk about chickens, but if you notice, his sweatshirt says UAF on it. And 2 years ago, he spent the entire summer doing chicken research in Alaska. So I suspect many of the people that are here tonight have met Jason. So thank you all for doing this program. And I'll put myself on mute.
Perfect. Okay. Thank you everyone for coming in. Hope everyone is doing well and is safe during this time. Like Steve said, my name is Jason Dahl. I just recently graduated from Tufts University School of Veterinary Medicine, but while I was getting my veterinary degree, I was also getting a master's of public health, and that's what brought me to Alaska, doing my senior thesis on biosecurity in backyard layers. And through that is where I met the wonderful Teresa Beck, and I'll let her introduce herself, and then we'll get started.
That's right. My name is Teresa Beck, and I am a lifelong Alaskan. My family moved here through the Army in the early 70s. So I had the great fortune to grow up here, and then I went away to veterinary school. I've been practicing as a veterinarian for 24 years this May. And so over these couple of years, I definitely seem to be seeing what I call more of the alternative species and regionally one of the only local people that will see a chicken. So plus having my own flock of 50 birds, well, chicken math, could be 50, could be more. I have chickens and turkeys. So I've learned a lot from my own personal birds as well. So I have a lot of experience seeing these kind of animals. So I just hope to help out, answer questions, as well as support Jason in his talk tonight. So.
Perfect. Okay. Well, without further ado, let me share my screen with everyone. Please bear with me, as this is the first time I have done this. Perfect. Okay, so we're answering the age-old question, which came first, the chicken or the disease, using your bird brain for the best flock management. And just want to, again, give a nice shout out to my co-presenter, Dr. Beck, as well as the Extension Office at UAF to present this talk to you all. Very quick disclosure statement. I was a student representative while I was in veterinary school that was one of the main providers of poultry vaccines. I don't currently work for them, and all of the resources that I will be using will be provided at the end, so you too can be chicken experts. So answering sort of the age-old question, we have a flock of birds. We can discuss a little bit later why we're having these birds, but you notice they're a little bit off, and you want to know what to do with that. Before you go on Facebook or searching social media or calling a relative, hey, my birds are doing a little bit weird today. Here's sort of a stepwise fashion of how to approach that. Because as Dr. Beck said, there are very few veterinarians, especially in the Mat-Su Valley, that see backyard chickens, and I think it's good for you to know the overall health of your flock because that will not only give you healthier birds, but it will also make your life a little bit easier. So when we're troubleshooting disease, this talk is mainly focused on the approach of disease. I'm definitely going to rattle off a lot of different diseases, but I think knowing the approach is really important. Just I've understood and what I've seen in Alaska is that there's so many different resources and material out there that I think it's so important for you to know the basics, especially which ones need to be reported to the state. So without further ado, when we're looking at our diseases in poultry, first we're seeing how many birds have it. So we all know chicken math. We start with 2, end up with multiple dozen. So is this just happening in one bird, or is this happening across the flock? And when did we first start to notice this? Is this something that's been happening for a long time? Has this been happening ever since we had them as chicks? Has this happened ever since their last molt? Or is this something that has happened pretty acutely? Is this something that has happened since new birds have been in our come in? Has this only happened to a certain breed of our chickens? Has this only happened to a certain age group? Our chicks, our pullets, our older golden girls, gals. But as we're going through this, there must be an acronym. This is a type of medicine. There has to be some sort of acronym. Well, luckily, there is. And you will not see this published anywhere. You guys are the first ones to see it because I made it up. And I got to use this very fun graphic that I think explains it all. So when things get all tied up with your flock, let's use Zipper, or zoonotic, infectious, pain, product, environment, and resources. So any comments, Dr. Beck, before we get thrown into Zipper?
Nope, you're doing great.
Perfect. Awesome. So Z is for zoonotic. And so this is really important because these are diseases that you can get from your birds, and in some cases are diseases that you can give to your birds. Of course, going into the current state of the world right now, we're pretty familiar of what live markets can give, as well as there have been a few case reports. There's actually another case report today of a dog that had goes positive for COVID-19. So we'll see where it goes. I know that makes Dr. Beck and I increasingly nervous, but having proper biosecurity is key. And you'll notice that I'm being very redundant in all of my slides. If you look at the very bottom, prevention and proper biosecurity is key, which we'll talk about that in a little bit. But you'll notice that that's a very recurring theme of this whole presentation. So when you're looking for zoonotic diseases, we're looking for something that is can be pretty acute, where the birds are becoming a little more lethargic. In the vet world, we call this ADR, or ain't doing right, and can result in either the sickness or the sudden die-off. So this is something that you'll probably notice quite rapidly, and it's quite a shock sometimes to most people. And or you could see some illness. Normally it's flu-like symptoms, but we'll talk about that in the next slide about the people working with them. Or we've all heard of like farmer's lung or something like that, of chronic exposure to chickens, but I'm talking more about diseases that could be preventable, but let's dive into those. So here are the ones that are reportable. This is why zoonotic diseases are so important, is because the majority of them are reportable to the state, and unfortunately, a lot of them can be prevented because of proper biosecurity, but then in turn, a lot of these don't have any sort of treatment. So we've all heard of the avian flu, the different strains of those, H3N8, and all of their friends as well. Exotic Newcastle, I saw we may or may not have someone from San Francisco by their background, but a few years ago and still ongoing now, the exotic Newcastle disease, which is a viral disease. A lot of these are viral diseases, has been plaguing the West Coast because of exhibition or because of exhibition birds. Plorum or Salmonella, that's probably one that a lot of people have heard of. Erysipelas, if anyone knows pigs, this is also known as diamond skin disease, but that's more common in turkey. So if anyone here is a proud turkey mom or dad, this is something that we need to worry about, and those are normally skin lesions. A lot of these are mainly either respiratory or enteric or GI upsets. And then West Nile, I know mosquitoes can be quite a problem up there in Alaska, so making sure that you have proper insect repellent for yourself, as well as making sure that you have nets and everything if you do have a problem. But that is more of again, an East Coast problem. And then I listed some of those other bacterial diseases as well, especially Staphylococcus or a staph infection is another disease of the skin. So moving forward from diseases that you can give, your birds can give you, ones that they can give each other. And so again, we're looking for very similar things, acute lethargy or sickness in multiple birds with could be a sudden die-off, especially when introducing new birds together. So during swap meets and everything, this is why proper quarantine, which I think everyone understands what quarantine is now a little bit better, but we'll go through that in the next slide. But I think one of the diseases that people think of the most that this graphic is showing is talking about Mareks disease. And so Mareks disease, that's an immunosuppressive disease of normally very young chickens. Normally they're vaccinated at the hatchery, and it can cause a type of lymphoma as well as paralysis, because it can affect those peripheral nerves. So if we ever see a chicken going, one leg out, one leg back, I could affect that sciatic nerve. So that should definitely be a differential, and that bird should definitely be isolated. Unfortunately, there's not a treatment. The treatment is primary prevention or vaccination. And so unfortunately, there's no, like for a cat and a dog, a single dose vial of Marek's vaccine. Normally, this is something where you need a big bottle of it. And I'm going to talk about an organization in the Mat-Su Valley, the Last Frontier Poultry Association. That they're a good resource, and they have sporadic times when they have birds, when they get the big bottle of Marek's vaccine. So here again are all of those, a list of the diseases. This is not this is a very exhaustive list, but this is not an all-inclusive list, but these are the ones that are most common, and especially ones that when I was working in Alaska, where people at least have heard of them or at least had experienced something like that. So going on the legend on the left, the ones in green are the ones available for the vaccines. So you can see a lot of them are, and then again, a lot of these overlap with what we see being reportable to the state as well, to Dr. Gerlich. So P, the first P is for pain. We know our birds can sometimes be a pain, but let's look at when they're in pain. So this is really important, and I think something that a lot of pet owners need extra counseling on and everything, just because humans and animals experience pain in very almost identical pathways, but they show it very differently. And so in our cat and our dog, again, this is a cat model. This is the Colorado State pain scale at the bottom of the screen. I know it's a little bit small, but even from I like how there's both words as well as a graphic. And so you can see the cat just sitting up, being pretty alert, to the ones that are a little more hiding to a point where they're in excruciating pain and there needs to be medical intervention. But that's a carnivore, whereas the majority of all of our backyard poultry are all prey species. And so they like to hide their pain, they like to hide their disease until that, right on that. And then, so the #1 cause of pain, Tufts did a little study in 2014 to 17 to see the most common admission in their ER for backyard poultry, and the #1 cause is trauma. And usually that trauma is due to a predator. And so if we look in this table, it sort of talks about a lot of them. I know not all of them. This is written by a veterinarian that's on the East Coast, but this is what we see normally here. I somehow wrote on everything. Sorry, little mink. Let me just take this out. Thank you for being patient. Any questions in the chat so far, or can I press forward?
No questions so far, but I do want to remind anyone, if you do have questions during the presentation, you can put them in the chat box. If you don't know how to access your chat box, just hover over the bottom of your screen and click on the chat button. Thanks.
Perfect. Thanks, Gina. Awesome. So this is how you can sort of sleuth out, be your own Sherlock Holmes. Oh, sorry. Be your own Sherlock Holmes in your backyard of exactly what sort of critter may or may not have gotten your birds, since I know that's always a very tragic thing to see when you come home and your birds are in less of an active form / or decapitated. So a lot of this comes to proper coop management, as well as being very vigilant of bringing your birds in at night, as well as being very careful and taking in the responsibility of free ranging your birds. I know it's always so picturesque to see your backyard filled with birds everywhere, and especially if you do have a sizable flock, but that's always a risk that you need to take, especially being in the wilds of Alaska.
I wanted, can I just say something real quick?
Oh, absolutely.
Jason? I know, especially this year in the Matsu Valley, we've had a lot of fox damage from birds getting eaten by foxes, and people actually seeing birds, either corpses left behind with feather piles, and or actually physically seeing foxes taking away birds. So just FYI, beyond neighborhood dogs, that would probably be number 2 as far as typical poultry attack in your own yard.
Perfect. Thank you, Dr. Beck. Yeah, I wasn't exactly sure. I knew mink is pretty popular predator of these birds, but good to know about the foxes as well.
There was just a comment from Heather Carey. She was talking about hawks. Yes, definitely birds of prey for sure. I know I myself personally, before I put a net over my cage, I lost a whole flock of baby turkeys to must have been a bird of prey. I didn't actually see it, but that was the only thing that could have gotten in there. So
yeah, so especially when you're building your coop design, which we'll talk about that a little bit, and I know Steve goes into that a little bit, but making sure that all angles of your flock, as well as spaces, mink can get in for a diameter as small as almost less than an inch or so. I think it's like half an inch. So they're pretty wily that they can get in there. And then again, always factoring aerial predators as well. And if you live in a more forested area, knowing what animals are roosting in your backyard as well. I remember when I was in Alaska, I had a question from someone on the Kenai about bears. And if you have bears in your area, there's very little things that you can do to deter them. I was seeing all sorts of comments about leaving bleach out and everything, but that just doesn't sound the safest for both you and your birds. So I'm sure if you're in a garage or something, that would probably be the best. But most times, at least all the reports that I've seen from bears, if a bear wants your flock, unfortunately, the bear wins. So going back to pain, Dr. Beck was nice enough to take a picture of, is this from Pet Zoo, Dr. Beck, or is?
Yeah, the Animal Food Warehouse on the Palmer-Wasilla Highway in Palmer.
Okay, awesome. So this is sort of the selection that you guys have in terms of drug use that you can do. I know that probably everyone has used this Vetrex down here at the end for your respiratory problems, but if you notice, none of these target pain specifically. So they might help with a disease process that might be causing pain, but none of these are actually directly helping to treat pain. I think that's something really important to know. And especially, I know people of all backgrounds have chickens, which I think is great, but never perform surgery on your chickens, please, without the help of a veterinarian. You need proper pain management. They have the same pathways that we do. And so that's sort of my little PSA that please don't rely on these products for pain control. These are definitely adjunctive to that, and especially probiotics and electrolytes are amazing, but don't rely on these for pain. So our next key, sort of going off of pharmacology, are our products or the purpose of why we're having these birds. So the majority of us are probably having them, if not for companionship, for eggs. They may be part of a breeding flock, so for fecundity, or for meat as well. And so this is really, really important because any sort of disruption to health can impact how much product that they're able to give. So a sick bird is not going to give you an egg every day. A sick bird is not going to produce the best chicks. A sick bird may or may not have good meat, especially if there's any sort of trauma to the pectorals or anywhere else. And so it's really important for us to utilize FARAD, which is the Food Animal Residue Avoidance Data Bank. So under federal law, backyard poultry are still considered meat producing animals and food producing animals. So that means that any drugs that we give them needs to be within a certain withdrawal time. So again, diseases that they can give us, we definitely don't want any drug residue in them while you're giving their products out and everything. And so FARAD is something that is free for veterinarians. So again, another reason to find your neighborhood veterinarian that will see poultry, and they have access to this for free, just because a lot of the drugs that are being used either have to be used off-label with the understanding that this animal can't be eaten again, or the understanding that certain drugs just can't be used for human safety as well. And FARAD is awesome. They normally get back to you within the same day. They're very experienced pharmacology veterinarians that are always willing to help and answer all of our wild questions. Right, Dr. Beck?
Yes.
Perfect. Now moving on to E, we're almost done, I promise, is environment. So the reason I created Zipper is the acronym that's normally used for poultry production, especially in turkeys, is called FLAWS, which I think that doesn't, unless you're talking like flawless and you're like Beyonce people, you don't want to be told that your flock is flawed. So that's why I created Zipper. But I think FLAWS is still really, really good acronym. So I actually just stuck it in here as well. So the feed, the light, your airflow or ventilation, which is really important in the winter, your water source, and then your security and sanitation. So this is where your biosecurity comes in. So you want to look for any seasonal issues that are happening. Bumblefoot, I think, is a classic example, as well as those upper respiratory infections that are pretty common during the winter as well. So making sure, if you're noticing this in all of your birds, this is something to sort of think of this acronym within an acronym, because that's really, really important to do that. And these are things that you can really control. These are all things that we can control, but especially this one, it's imperative to have good husbandry in order to have a good outcome and good health. Okay, so treat your chickens like they're VIPs, because I know that they're a part of your family. And so I think this is one of my favorite images right here. So the literal biosecurity, keeping all those gross little microbes out, and putting, I don't know why the red carpet is green. Hopefully we don't have Pseudomonas or anything, but keeping all of our farm and feathered animals nice and careful. So biosecurity is essential, so especially if you're getting birds from a swap meet or anything, making sure that you're not cross-contaminating, not wearing those boots that you wear on your farm. Have some home boots and some outdoor boots having a place where you can wash all of your clothes before entering your flock, and then keeping a place where those new birds can be isolated for at least 30 days, and cleaning and feeding them last, since they're the dirtiest of your birds. And that works the same if you have a sick bird as well, to isolate them, to have enough coop space and everything, so there's physically a different location, and that gives you a way to keep a check on them for the 30 days as well. And then disinfecting all of the fomites, or all of the physical things that you can. So I think people are pretty good with how biosecurity works and how quarantine works, and it's not too much different, but it's 30 days instead of the 2 weeks that most people are talking about for COVID-19.
We do have a question about that last slide from Heather. Asks, what does it mean to clean and feed them last?
Sure. So when you're going through your normal routine, so if you're doing like cleaning your coop and everything, you want to do the healthiest birds first. So those are normally your youngest birds, and then you go through, this is pending you have like different coops and everything, but you will physically be at that coop last, and then you'll wash your boots and everything if you have to go back. But especially if you only have one like scoop or anything, like it's ideal to have multiple of them. But if you have a scoop for your feed, to feed like the healthiest birds first, and the ones that you know that are healthy. So for the ones that are in quarantine, we're still uncertain about their health as well. So going in a stepwise fashion, you can certainly go back to your other birds at the end of the day or after you finish, but you want to make sure that you sanitize your boots and sanitize any equipment that is shared between them, and ideally to not have shared equipment in general. Is that good? Awesome. Cool. Do we have another question, or?
We do. Heather also would like to know if there are diseases specific to winter versus summer.
So during winter, we definitely see a lot more respiratory infections, just because some coops don't have the best ventilation. And this was the thing that surprised me the most about Alaska is your birds are so cold hardy that they love going out in the snow. I remember actually talking to Teresa's sister, and she actually shovels for them, and her shovel is about the same width of like 3 of her birds. So she just makes a little shoveling path for them, and they're out in the snow and everything. So definitely your respiratory infections, and then your bumblefoot as well. And so that's a staph infection of the bottom of the feet for being on a hard surface for too long. So that's why proper roosting and perching is really important, and to make sure that that's really clean as well, because if there's any disruption of the skin, the staph bacteria that lives normally on the bottom of the feet can actually infiltrate and cause a pretty bad abscess. Any additions to that, Dr. Beck?
No, that sounds great.
Perfect. Okay, so we're at the end of our zipper, whatever that is technically called. So these are our resources. So at the bottom, you see that goofy guy with the chicken, that's Steve Brown, as we all know. So he's a really good resource for you, as well as the Last Frontier Poultry Association. They're the ones that have the large bottles of vaccines. And then sort of in the middle, this Chicken Health Handbook. I love this book. It's very friendly for both veterinarians as well as I don't get any money for them, don't worry, as well as for flock owners as well. And then not to insult anyone, but I love if you ever reread like their For Dummies books, they have really good references at the end of all of their chapters. So I think that's always a great place to start. I have a few on my shelf as well, but it's the resources at the end. It's sort of like Wikipedia, where on the surface it seems, why are we using that? But the references at the end, that's the good stuff. That's what you want. And then FARAD is on there, the Association of Avian Veterinarians. That's that acronym right there, the poultry site, and then Merck has some really good options as well. So if you notice, I didn't put any Facebook groups or anything on here, but because these should be what you think of first. Not saying that blog posts, Facebook groups, and opinion pieces are bad by any means, because if someone has something to share, I think they definitely should, and you may benefit from that, but they're definitely supplemental. So definitely start with these resources, and then if you're sort of exhausted there after contacting your veterinarian, you can definitely go there or start your own blog. So so that was Zipper, if anyone has any questions about that. But sort of to backtrack, how do we even know that your bird is sick? So let's dive into that a little bit. So the first thing that I think everyone is pretty attuned to is their bird's behavior. How are they interacting with the other birds? How are they interacting with you? They have a literal pecking order, or as I like to call their personalities. And so you're the person that's with them every day. You know them better than anyone else does. And so if there's a change in their behavior, like try to note that and why that is, and what exactly you're noticing, because whenever you ask someone, they'll ask a million questions back. So if you can be as specific as possible, that's really important. And then looking at them, this is before you even touch the birds, do they have clear eyes? Some diseases, especially parasitic diseases, such as fleas can be right around the eyes in that apteric or that featherless tract right around their eyes. Do they have a nice red comb and wattle, especially in the winter? Frostbite is another disease that, again, is very seasonal. And then they have dry nostrils, no discharge coming from their nares. Their feathers. Feathers are 85% protein, so making sure that they have adequate protein in their diet, that everything's clean and in order, that their tail is erect and isn't droopy, and that they're maintaining themselves as well. A bird that is in pain, a bird that is sick, is not going to preen itself. Its preen gland is right at the base of its tail. And so if it's lethargic or is overconditioned or anything, it won't want to preen itself. And so that's one of the first signs is after behavior, after looking at its face, looking at its feathers as well. So picking your bird up. So the crop, so that's a distension of the esophagus. That's where a lot of storage happens. That's right under the skin. You can normally feel it right after your bird has had some food as well. It's kind of cool to feel. It should be about the size of the golf ball. Shouldn't be dragging down. Pendulous crop is what it's called if there's sort of a motility disorder, whether it is backed up due to grass clippings or any forage or anything, or some diseases like Mareks disease can cause decreased crop emptying. And so those are things to think about. And then your body condition score. So over here, this is sort of looking at the bird if we would sort of do a cut down the middle, so that keel or breastbone stays sort of constant, but then we can see a bird should never have cleavage, as we say. If we get past a 3, we actually have a little bit of a pooching, and in the parrot world, that's known as cleavage, and we don't want that in our chickens. No. Our vent, or where eggs and feces and everything come out of, that should be nice and clean. It should be a little bit drier and tighter in our non-laying birds, and then for birds that have been laying a lot, it's going to be a little bit moisture and a little bit more vascular sometimes. And then their legs should be nice and cool and smooth. Sometimes if we have mites, that can actually pull those scales on those legs back. So I know a lot of people are probably thinking like, oh, I don't really touch my birds that often. Well, here is a great way for you to be able to touch your birds every day and to mind how they're doing. So this is a chicken tractor. It comes in many different forms. As you can see, there's a weird looking leghorn down there. That's my personal rabbit, a chicken tractor that I use for him in the summers. But this is a great way to move your flock around and sort of have the sense of having free range birds, but without having them physically out with all the predators and everything. And it's a good way to be having a chance to pick up your bird every day, give them a quick physical yourself, and then put them in there. Because sometimes you're like, oh, that bird looks kind of weird, and then it sort of moves around in the fray, and then it's sort of hard to pin down exactly why, which bird it is, especially if you have a larger flock. And then this is also really important of their stress level as well. We don't want to overstress our birds when we're handling them. And then, so how are we going to document all of this? Well, in a calendar is always a great place to do it, because I know whenever I am out and about and I don't write something down right then and there, it did not happen. So having a calendar in your coop, again, I don't get any money from this lovely calendar, and I know that we're already halfway through, almost halfway through the year somehow, but this is a great way to document everything, and it's a good way to put how many eggs you've been getting, any abnormalities, the daily temperature outside, because if it's pretty hot for a few days and then you notice your birds are a little bit off, it's like, oh, we had that heat spell then, or we had 6 feet of snow or something like that. So having a calendar is really important, especially when you go to reference your books and everything, or your blog posts, or when you're talking to your veterinarian. It's always good to keep good records, because even if these are just pets, they're still farm animals, and so it's always good to have a good farm log. Okay, so the rest of the presentation is some case examples, and I can forge on with those unless there are any questions that anyone has.
No questions at this time.
Okay, perfect. So we have a left leg out, and this is a very, very common presentation, as I talked about before. So let's think about Marek's. Is this something that is more of a systemic presentation? Sometimes the lymphocytes can create what's known as gray eye around the pupils, but more often than not, you have this paralysis that's usually unilateral due to one of those sciatics becoming pretty enlarged. We want to isolate immediately, and then unfortunately, there's no cure for this disease. So especially if this bird's quality of life, they're not able to get around, they're not able to feed or anything, is a reason to euthanize your bird. Trauma, so again, something that we think about for pain. Look to see if there are any evidence of predators. Look to see if there's any adversarial relationships, and then seeing exactly if you can touch it, if there's any sort of effusion or fluid in those joints, or anything like that. But normally, especially if it's MG or that Mycoplasma gallisepticum, normally that it can be a bilateral presentation. Slip tendon. That is a nutritional disease normally caused by manganese deficiency. Something else that you can see with manganese deficiency is called parrot bill, where their top bill actually grows much faster and curves over like that. And then another deficiency is the selenium deficiency. So this is normally due to low selenium in the soil. And so testing your soil in various spots. This is a big problem on the East Coast as well as the West Coast as well, where there just isn't a lot of selenium in the soil. So if you've heard of BOSI or MUSI, that's normally used in cattle. That's something that could be used as well. And then if they're just doing a little chicken dance and doing a little spin on that, that might just be the hokey pokey. So it'll turn itself around. So no cause for alarm. I try to be funny on these things, and I'm not hearing anyone laugh, but I'll just pretend because it's all, you guys are all on mute. Our next one is feather loss. So as we know, we have our annual molt. And then again, it depends on when you got your birds. I know that there's been a lot of birds coming into Alaska as of late, and so those birds probably won't go into molt until sometime next year or during the winter, and that is due to not enough protein. Again, feathers are 85% protein, and so it's so important to have enough protein in your diet, because eggs are also very high in protein. And so when they're battling out for that, unfortunately, the feathers, even though they're a little more essential than eggs, just the way that we've genetically modified our chickens, they put so much protein into their eggs that it'll cause their feathers to become poor quality. So the pecking order, again, behavior sort of comes back to a lot of this. So separating them out or removing any roosters, and then separating the alpha hens, and then resocializing them individually. Looking for parasites, so look at the base of the feathers, especially the body feathers for those mites or for parasite eggs. And then, excuse me, if a bird is broody or is sitting on eggs, she can remove some of those from her underside as a way to give more direct contact or heat to her eggs and her future chicks. Okay, I think this is our last one for the evening. So wrinkled eggs, so infectious bronchitis. This is the chicken version of the coronavirus, but it is not transmissible to humans. Do not worry. This is normally something that is vaccinated for, but it is an infectious disease, so you want to isolate, and as its name suggests, it can cause manifestations in their bronchus, and so just make sure that they're able to breathe okay, and if not, that may need immediate medical intervention, especially it can create a lot of really mucousy secretions and plugs, and so that will need to be dealt with as soon as possible. So a defective shell gland that can either be a congenital or a neoplastic. So sometimes in, especially our immunosuppressive diseases such as Mareks or avian leukosis, that can cause a defective shell gland. Remember, the shell gland is at the very, very end, right before we reach the vent in the uterus, and there is where the shell is put on. If there's any sort of defect there, that can cause abnormalities in how the shell is put on. And then stress also, especially in our new pullets that are laying eggs, if there's overcrowding, or again, looking at flaws, schema, if there's anything wrong with the light, the air, or anything like that, that can cause wrinkly eggs. So, oh, this is the last thing. So this is still going on, right, Steve?
Yes, it's still on. Hey, we had a question here. If you suspect Mareks in your flock, what can you do about it?
Sure. So it really depends on how many birds that you're seeing. You definitely want to isolate them as soon as possible. You don't want to add any new birds to your flock until you have definite. Unfortunately, the main way we do it, which again, being on this slide is unfortunate, but also what sometimes happens is if that bird dies, then you can test for it. And then in the future, you will need to vaccinate for that as well. But especially if they're dragging their legs and they're not having a good quality of life, if they're not able to empty their crop appropriately, it's more of a quality of life issue. So that's why you really need to vaccinate your birds if you're able to, either from the hatchery or when they're quite young.
I'll just say that up here, probably a lot of people, if you're ordering in your pullets and your birds from out of state, they're coming in vaccinated. I don't believe that most people, like if they're hatching out their own birds, that they're going to be vaccinated for Mareks. So if you're buying from like a local breeder or at the swap meet or something like that, your birds won't have any protection from the Mareks. And however, you know, I don't know how common it truly is up here, but it certainly is possible that could become a problem.
Okay, here's another question.
Sure.
If you suspect, oh wait, I'm pretty sure all of my birds are carriers at this point. Is there anything I can do? They seem fine, but I've got other birds with it. And yeah, I got them at a swap meet.
Yeah, so that's again why quarantine is so very important for them. Unfortunately, the main part of the immune system involute by the time they're 8 weeks old. That's the bursa fabricius. And so unfortunately, vaccination only works during that 8-week window. So it's really like symptom management and to really being able to completely sanitize everything in between flocks and to really do an all-in, all-out method. But if your birds are doing well now, I'm really happy to hear that. But definitely keep doing physicals on them as often as you can. And if you start to notice anything, especially pendulous crop or that paresis, to seek veterinary consultation as soon as possible.
All right. Well, I want to say thank you to Dr. Dahl and Dr. Beck for taking the time to do this evening, particularly on the East Coast. It's what, after 10 o'clock. So we appreciate this. If you have,
Absolutely.
this presentation has been recorded, and if you need it immediately, you can email me and I'll send you a direct link to it, but it should be posted on our YouTube channel by the beginning of next week. If you want to know how to find that YouTube channel, just go to the Matsu Experiment Farm and you'll find us. And there's all kinds of presentations on there about gardening and everything else you can imagine. So again, thank you very much, and we'll see you down the road.
Perfect. Thank you so much, everyone.
Yeah, thank you, Steve, and thanks, Jason.
You're welcome.